Hi, I'm Dr. Gois from Renaissance Health Center. I'm an naturopathic medical doctor and acupuncturist. And in this lecture today, we are going to review acupuncture basics. So, this lecture is good for people who are thinking about doing acupuncture. Maybe you've heard about it before, but just weren't sure and wanted to know a little bit more. This lecture will also be good for people who have had acupuncture before. Maybe you really love it. Maybe you want to explain it to friends and family that you want to refer over, but you're not exactly sure how. This can be a good lecture to help you kind of understand the basics of how Chinese medicine works. So let's get started. So today we are going to talk about what acupuncture is. We'll go a little bit into the history of Chinese medicine. We'll also take a look at what Chinese medicine looks like today. And we'll go a little bit over basic Chinese medicine theory. And then I'll show you the different acupuncture tools that we might use in office. And then we will go over the different styles of acupuncture, as well as what to expect at your first visit. And then we will go over what acupuncture treats. So, defining acupuncture. Acupuncture is defined as a system of integrative medicine that involves the pricking of skin or tissues with needles used to alleviate pain and to treat various physical, mental, and emotional conditions. So, what you might not realize though is that acupuncture actually belongs to the larger category of Chinese medicine, Oriental medicine. So, Chinese medicine is made up of the following modalities or treatment types. And so, acupuncture, which is what we're talking about today, it also includes cupping and something called moxa, which I'll go over a little bit later. And then we have the category of Chinese herbs, such as ginseng, is probably one that you're familiar with. And movement is also part of Chinese medicine. And so maybe you've heard of Tai Chi and Qigong. Those are actually considered part of Chinese medicine as well. And some practitioners will actually prescribe certain movements to help you with your qi. And another aspect of Chinese medicine is body work, which is called tuina. And this is kind of the Chinese version of chiropractic medicine, physical medicine. So with some forms of tuina, they actually do some adjustments or bone cracking. If you do know someone who is very practiced in tuina, I would definitely recommend it. It's an experience. And also, meditation can be a form of Chinese medicine. And so, Zen and Buddhist chants are actually, well, they were part of my schooling at the school that I went to. So, that's part of it too. Got to cultivate the mind as well as the physical body. So, looking into the history of Chinese medicine. Obviously, Chinese medicine is very vast. It's several thousand years old, but we'll just do a quick overview. So, as I said, Chinese medicine is over 2,000 years old. In fact, the oldest known record that we have of the Chinese medicine book is from the 3rd century BC, which is 300 to 201 BC. And this book is called The Yellow Emperor's Inner Classic. And if you know anything from back then, the reason that we don't have anything older is because the Chinese actually used to write with ink on bamboo strips. And so, because they didn't have very good protection back then, a lot of the old books that have been found just deteriorated, kind of like the Egyptian scrolls and things like that. But so the oldest known record we have is from 3rd century BC. And if you know anything about history, you should be familiar with the fact that before writing was a thing, everything like history, stories was all verbal. So those stories and the lessons and learning would have been taught from person to person before writing was invented. So We also have bone and stone acupuncture needles that are currently in some museums, and these are actually dated to be 10,000 to 4,000 years old. So we can't really claim that acupuncture is this old, but the tools have been around for that long. So I'm pretty sure they were used. Otherwise, they wouldn't have been made, right? And like I said, knowledge was passed down through families or lifelong apprenticeship. And that actually continued all the way up until the early 1900s. And so, because of that, Chinese medicine practitioners were few and far between. You had to do lifelong study or be born into the family where they would pass it down just bit by bit through practice over a lifetime. And so this next picture here, these are a picture of the bone acupuncture needles that are in a museum. And now we are going to talk a little bit about modern day Chinese medicine. So modern day Chinese medicine is also called TCM or traditional Chinese medicine. And actually, we can credit this to Chairman Mao or Mao Zedong. If you're familiar with the Chinese Cultural Revolution in the 1960s, he was responsible for that. And so, in the Chinese Cultural Revolution, they actually did do book burning, but he realized that Western medicine was actually gaining a hold in China, and he actually didn't want that. So he gathered famous Chinese medicine practitioners, and he forced them pretty much to create a system of Chinese medicine that could be taught in schools. And so traditional Chinese medicine, or TCM, was created. And so even though Chinese Cultural Revolution, like book burning, I definitely don't support that. But the fact that we got Chinese medicine out of it and it's now global, available all over the world, that's a good thing about it. And in fact, in America, traditional Chinese medicine became popular in the 1970s. And just a quick little fact was that Nevada was the very first state in the US to legalize Chinese medicine in 1973. Go Nevada! Okay, so we'll go into a little bit of Chinese medicine theory. And so in this photo here, let me make it a little bigger. We have three images. The first one here, that brushstroke, it is called the Tao or the One, and it signifies that everything is whole. There is one source, just energy, that sort of thing. The second image you should be familiar with, yin and yang, light and dark, male, female. We're all familiar with yin and yang. And the third image, this is an image showing the five elements. And this is a very essential basis for Chinese medicine. This is how Chinese medicine diagnoses are based off of. And so you actually want all of these elements to be balanced in perfect harmony, and that means you're healthy. But when something is out of balance, it affects the whole system. So for earth, so your digestion, if your digestion is off, that means it'll affect other things. If you have, for fire, you have a lot of anxiety, lots of stress, that'll affect, earth and the wood before and after, and so on and so forth. And so if you read this from left to right, the division goes, everything is one whole. Then we have duality, yin and yang, and then we have the five elements, further division. And so for yin and yang, we should be familiar with this. So yin represents the female, it represents cold, night, and dark. And yang represents male, it represents heat, the day, and light. So you can see that they are just opposites, and we have to have opposites. You can't have happiness without a little sadness or anger, that kind of thing. And then the 5 elements. So this is just a little bit more about each element. So wood, typically we always start with wood because wood represents spring. So spring is when the green sprouts, green grasses shoot up from the winter. So green spring, it's also associated with liver and the emotion anger. And next we have fire. So spring goes into summer and wood goes into fire. And so fire represents redness. Summer, it represents the heart organ, and joy, happiness. And then we have earth, which is yellow, and it represents the center or transition. And it actually represents the organ, the spleen, and the emotion that can go with it is worry or pensiveness. And then after earth, we have metal, which is white. It represents autumn, and it represents the lungs and the emotion of grief. And then we have water, which is blue. It represents winter, it represents kidneys, and the emotion of fear. And then, if you can see, all of the elements are connected by a circle. And so all of the elements go from one into the other, just like the seasons. Um, Earth actually, um, even though here it comes right after fire, there are actually other versions where Earth is actually in the center. And so after in between each season, there's a little transition, and you have like Earth in the middle of those transitions. So sometimes when I talk to patients, like a lot of them have digestive issues. And so digestion is earth, that is the spleen organ. That's the center of all the other organs. And so if digestion is off, eventually all of the other elements, the energies of your body will be off too. So often anxiety creates digestive issues, heartburn. And if you can see here, they're like connected, like one right after the other. And so, in Chinese medicine at least, that's why anxiety and stress can lead to digestive issues. Chinese medicine is fun, right? Okay. Another thing to know with Chinese medicine theory is that they believe that the body has different energetic layers. So the first layer is the spiritual energetic layer, and you can think of this as your spirit or your aura. And then next we have the mental emotional layer. And so these are the emotions: anxiety, depression, worry. And then we have the physical layer. So in the physical layer, we get pain and disease. And so for disease, at least chronic disease, the Chinese believe that it starts on the energetic spiritual layer. If you don't do anything to clear that out, eventually, over time, that's going to develop into mental emotional disease: anxiety, stress, worry, sadness. And then if you don't deal with that emotional layer, which is just common, we're just taught not to really deal with our emotions, just to ignore them and just, keep going with our day. At least in Western medicine and in America, that's what we're taught. It leads to disease in the physical level when you don't address that. So pain, disease. So I was talking earlier about your stress, and then that creates heartburn. That is how, disease on the mental emotional layer, stress, anxiety, if untreated, turns into the physical layer, becomes heartburn. Does that make sense? Okay. The next one, we are going to go over acupuncture tools. So for this next slide, if you are queasy at all about needles, sharp, pointy objects, just look away. Okay, for this next part, if you are at all just a little bit queasy about needles or sharp objects, just look away for a little while. All right, so the very next slide, this is to show you what acupuncture needles look like. So they are very slim and tiny. If you can see on this first image here, the acupuncture needle is on the bottom. Above that is a syringe. It's a little bit bigger, as you can see. Above that is a clothespin, bigger, and then above that is a toothpick, which is even larger. So acupuncture needles are like, you know, not even a whole millimeter, like less than a millimeter in width, much less than a millimeter. Excuse me. Um, all right. So if you're all queasy, I've had some patients who have been scared of acupuncture needles. Some of them just close their eyes and don't look. But I've had one person who she was actually so afraid. She didn't tell me she was afraid. She was so afraid of acupuncture needles that she actually started crying on me. But after the way that acupuncture made her feel, she actually started to love acupuncture. And she comes back every now and again for a tune up. So even if you are a little bit queasy, I would recommend giving it a try at least once. If you absolutely hate it, can't handle it, that's okay. But you should at least try it to see if you can, in fact, enjoy the treatment or at least enjoy the effects that acupuncture can give. All right, so the next tool is cupping or cups. So you guys should be familiar with this, or at least if you watched the 2012 Olympics, I believe Michael Phelps had a bunch of circular bruises on his back, and that's how cupping became popular again in the US. In fact, when I was little, I had noticed that, all the Chinese athletes had those bruises, but no one really talked about it until Michael Phelps actually had them on his own body. Um, so, cupping is really good for muscles and pain and tension. It helps to actually suction the skin and the muscle and relieve that pressure that's inside there. All right, so the next tool is moxa or moxibustion. And moxa is this Chinese herb here. You can see there's this stick form, and then you can also have a loose form that you can form into these cones in the second picture. And it is an herb, and it actually just helps to add energy to the body if there's deficiency. It's also good for pain, and it's good for stagnation because it will actually help to move that around. And by stagnation, I mean energetic stagnation in the channels, as well as stagnation in the muscles. So, whenever there's pain and tightness in the muscles, then there is stagnation. If there's a bruise, then there is chi stagnation and blood stagnation. Um, and moxa is good for that. All right. So, before going into acupuncture, it would actually be good to know that there are different acupuncture styles. So let's review what those are. And so there are more than these, but these are just kind of the basics. So there's Chinese style acupuncture, and they generally do use deep needles, and there can be lots of twisting and thrusting in order to create a strong sensation. And so that is actually what they're going for, because they believe that that strong sensation will get the energy to do what they want it to do. Japanese acupuncture, though, is actually the opposite of that. It's very superficial. The needles are actually very long and bendy. Only a little bit goes into the body, and there's lots and lots of tapping in Japanese acupuncture. And then we have Korean hand acupuncture became popular, or it was developed in the 70s. And so there's something in Chinese medicine called the macrocosm and the microcosm. So the macrocosm is the larger universe, or in terms of Chinese medicine, it is the body in and of itself. And the microcosm is the smaller image of the body in a smaller area. Like, for example, for the ear, with ear acupuncture, the whole body can be represented in the ear. If you are familiar with acupressure on the feet, the whole body can be represented on the foot. So that is the microcosm that represents the larger macrocosm, if that makes sense. And so in Korean hand acupuncture, you can treat the entire body with just the hand. And there's also scalp acupuncture, where it's just focused on the scalp, and as I mentioned, ear acupuncture, and so on and so forth. And there's lots of actual different kinds of acupuncture as well. There's different American schools of acupuncture. So, what I'm trying to explain with this is that depending on where that person went to school, who they studied with, they will have a different style of acupuncture. So if you went to one person and you didn't like that experience, maybe it was very painful for you, I'd recommend going to someone else, and giving it a try until you actually find someone that you like. And that's okay. We're all individual. We all have different needs. Some patients really do like that strong acupuncture. Usually, men that are bigger, bulkier side, like athletes, that kind of style would be really good for them. Maybe if you're more fragile, very sensitive to pain, the Japanese style could be good for you. So take a look around. Even if you had a bad experience, try again and maybe talk to the acupuncturist and find out what kind of style they like to do. All right. So, what acupuncture can treat? I'm sure you guys are all wondering, but honestly, it can treat everything. So, um, in Chinese medicine, they believe disease is created by imbalance in the body, and acupuncture seeks to fix that imbalance. And so, where it really excels, I found, is the mental emotional sphere. So, if you have anxiety, depression, stress, PTSD, any sort of mental emotional issue, acupuncture can really help with that a lot. It's also very good for physical pain, acute or chronic trauma, and it's good for autoimmune diseases, cancer, and arthritis. And mainly in these diseases, um, it's more about just supporting and nourishing the body, and we can do that with acupuncture. And even if you don't really have anything wrong, you can still come and get acupuncture anyway. It can help boost energy and it can help us sleep. Even if you don't have any complaints, you can just go in. The acupuncturist will take a look at your Chinese medicine pulse and tongue, which we'll go over in a little bit later. And then they can decide how to treat you, even if you don't have any specific complaints. All right. And what to expect at your first visit. So, you are going to want to wear comfortable clothing. Depending on the clinic you are at, you may be able to ask for a gown to change into. But if you're wearing very loose, comfortable clothing, like this dress this woman has over here, we can just move the clothing around very easily to put needles where we want. So after you are comfortable in the room, after they have already talked to you about your purpose for getting acupuncture, what you want to treat, they will check your tongue and pulse. And I have a picture on that later on. And then where they decide to put the needles can be different each time. It all depends on the symptoms that you're having and what they find in the tongue and pulse. And sometimes you may or may not feel sensations with needle insertion. It's okay if you do, it's okay if you don't. It's really all individual. And once you have acupuncture, you'll find out what it's like for you. And then, if any of the needles like really hurt, if the pain's not going away, let the practitioner know because they can adjust it so that it's not hurting. So, when it comes to acupuncture placement, there's lots of little capillaries, like nerves are all over the place. Like just, touching your skin, you can feel it. And that means that there's a nerve that's working there. So if something hurts a little bit too much, just tell the practitioner, and then they should be able to adjust it so that it doesn't. Um, and it should be a relaxing experience. So, generally, I always take it as a good sign when the patient can actually relax enough and take a quick little nap. For me, that means that the energy is actually moving around and the body is doing something. Because if you're familiar with health and sleep, when we are asleep, that's actually when our immune system and our body is actually able to do a lot of the healing and detoxing and things like that when we're asleep. So if you're not getting enough sleep, maybe you should come in for some acupuncture and we can work on that, get your body functioning better. All right. So this next image is just about the tongue and the pulse diagnosis in Chinese medicine. So looking at this tongue here, you can actually see it's slightly a little bit flabby. There's very slight teeth marks on the side, and at the very tip, there's some redness and some dots. Can you see that? So that tells me that at least for the red dots, there's probably some heat in the upper body, upper chest, maybe heart. Maybe they have some anxiety, stress. The very, very minor teeth marks show that there's some digestion issues or spleen deficiency, um, things like that. And so down on the bottom, this is how we check the pulse in Chinese medicine. And it's less about, the beats per minute, which that can be important as well, but it's actually more about the quality of the pulse. And so as you can see here, we actually use three fingers and there's three pulse positions on each hand, and they each tell us something a little different. All right. So frequently asked questions. These are often questions that I get asked in clinic. So does it hurt? Yes and no. So everyone has different level of pain tolerance. Some people are hypersensitive, others don't notice anything. It's also important to know that different parts of the body have more nerve endings and are more sensitive than others. So the hands and feet are very sensitive. So they will generally hurt more than, say, the abdomen. And also, you may feel some sensations, such as the initial needle insertion. There could be a zing that moves up or down the body, and that's just fine. Also, if the practitioner manipulates the needle by twisting or tapping, that is to call up the energy, the chi of the body to meet the needle and get it to do what we want it to do. And these sensations are temporary, so they should dissipate. If after the manipulation, the insertion, all of that is done and it's still hurting and the pain hasn't gone away, let your acupuncturist know. So, why do some parts hurt more than others? So, we actually talked a little bit about this. Some parts with more nerve endings will be more sensitive, so the hands and the feet. For women, actually, if you're on your menses, that will increase sensitivity to pain. And then sometimes one part of the body will be more sensitive than the other. So the right side of your body is considered more feminine, and the left side is considered more masculine. So again, this is another aspect of yin and yang in Chinese medicine. And some specific points are more sensitive. And that could mean that there was actually a chi blockage in that area. So chi is the energy of the body. So there's a buildup of energy. And so when you access that with the needle, it releases that energy and causes pain. But again, it should go away. Next, how often do you need acupuncture? So typically in America, it's best to get acupuncture once per week. At Renaissance, initially, we recommend 2 visits a week for the first 2 weeks. And that is to help us get to the point where you actually start noticing some changes. Research has actually shown that after 4 visits, that's when people start noticing acupuncture benefits. And in China, they actually get acupuncture every day until they're feeling better. And then once you're at a point when you're feeling better, then I do recommend monthly tune-ups to just keep everything running smoothly. So I have had patients before that have come in like after 2 months, and then they tell me, you know what, I should have come in last month. Um, Not that they're feeling sick or anything, but they just feel better. So if you stop acupuncture, you'll be fine. However, if you continue the same lifestyle that brought you in the first place, most likely you will backslide. Um, so, what will happen if you stop acupuncture? Essentially, you'll be fine. Nothing's really going to happen. However, if you continue the same lifestyle that brought you into acupuncture in the first place, most likely you will realize that your symptoms are backsliding. If you are in tune with your body, you'll actually be able to feel it when you need to come back in for acupuncture. And I've had patients tell me that after staying away for 2 months, they could tell that they needed to come in earlier. Um, I actually think I mentioned that before. And also, acupuncture just keeps you balanced and improves your sense of well being. So it's good to come in regularly. And that's it. Your health is your greatest possession. So if this lecture has increased your interest in acupuncture, maybe you want to actually give it a try, give us a call and schedule that appointment, and I'll see you in office.